Welcome to Adapt NCLEX. If you're looking for a practice test that will challenge you, will bring your content, will force you to think critically, will ask you questions that usually show up on the NCLEX, this is the video you want to watch. 85 questions. I'm going to challenge you. I'm going to push you. I'm going to give you concept to use to answer the question. By the end of this video, you'll feel ready to take the NCLEX. Grab a pen and paper, write down your answer. I'm going to guide you with the concept and use it to answer the question. I know you're going to pass. Are you ready? Let's get to it. This is like a random question, like the NCLEX mock exams. You don't know what you're going to get. First question, what do you see? Infectious control, strategy, how to answer them. Don't worry. Read the question from the back. Select or apply. Don't over-select. Which of the following clients should the nurse don what? Gown, gloves, surgical mask when providing care. Select or apply. Those are the buzzwords. A nurse is caring for multiple clients on what? Pediatric unit. A client with respiratory syncytial virus. A child with what? Influenza. A child with what? Bacterial meningitis. A child with what? Pertussis. A child with what? Varicella. Which situation the nurse should wear gown, gloves, and surgical mask? Don't pick your answer, please. Wait, put everything together and figure out what the question is asking you. Pay attention to the gown, gloves, surgical mask. If you had it together, which situation you have to put all these three when you taking care of the patient? Pause the video, pick your answer, keep track of your record. But I can tell you, the strategy is to find the organism where they belong. RSV, yes what? Droplet and contact. Influenza, droplet. Meningitis, droplet. Pertussis, droplet. Chickenpox, airborne, and contact. Based on that, what do you think? To wear surgical mask, you don't need it for airborne. You need N95. This is gone. To wear surgical mask, you need it for what? Influenza, bacterial meningitis, and pertussis. But you don't need gown and gloves because there's no contact. Therefore, what is the answer? Only one answer. RSV. If you overselect, you make sick. Don't do that. Just follow the concept. No matter how hard they ask the question, you will figure it out. Trust me. Second question. A charge nurse is planning client assignment for LPN on the medical surgical ward. Which client assignment will be appropriate to the LPN? Client newly diagnosed with diabetes awaiting what? Discharge. That's the buzzword. Client with gastrostomy tube who need what? Enterofeeding, G-tube. That's the buzzword. Client with chest pain awaiting cardiac catheterization. Is the buzzword. Client who just arrived to the ward post transurethral resection of the prostate. Just arrived. Those are the things you fall on to answer the question. What does the LPN does? MMR most. Monitor, reinforce, does not provide teaching, but reinforce teaching, but there's specialized things they can do. Stop the video, pick your answer. Which answer choice do you think is the right one? Of course, they can take care of gastrostomy tube because they can provide enteral feeding through G-tube. Any stoma, they can care for it. Awaiting discharge, they don't provide discharge teaching. Cardiac catheterization will require some teaching. After that, they will require assessment after the placement. Just arrive to the ward, need an assessment. Those are all RN responsibility. They can do that. Which client situation require immediate follow-up? Prioritization. What do you think? And then it's triaging phone call at the mental health clinic. This is prioritization. Client prescribe what? Clozapine, pharmacology prioritization, reporting what? Drilling. Is this what you expect? Take clozapine, join drilling together and say, do I need to see them? If I see them, should I worry? Client prescribe what? Quetiapine. Okay, what is that? Client is reporting what? Muscle stiffness and what? Feeling hot. Quetiapine, feeling hot, muscle stiffness. Is that something I should worry about? Client prescribed phenytoin, reporting not be able to stay still. Not to be able to stay still. Restless. Client prescribed allopurinol, reporting max-like face. You're taking what? As you can see, all of them are what? Antipsychotic. What is the major side of antipsychotic that you should worry for your NCLEX or nursing school? Is right there. Did you see? Did you pick your answer? Did you stop the video? I know you picked the right answer. But I can tell you, quetiapine, muscle stiffness, and feeling hot is NMS. That's bad. Clozapine, reporting drooling is hypersalivation, expected finding. Phenytoin, first generation antipsychotic, not able to stand, that's EPS. Not able to stay still, that's EPS. What does that mean? Akathisia. And if you take allopurinol, first generation antipsychotic with the max-like face, that's called Parkinsonism. That's EPS. We're going to pick number 2, bad problem. And this is assessing a client experiencing alcohol withdrawal. Which of the following findings should the nurse suspect? Selected apply. When they come to substance, what? Misused. That's the new word the NCLEX is using now. Substance misused. What do you think? You don't have to memorize. Take the substance, put it in the group, and ask yourself, am I taking in too much? That's what? Intoxication. Or I'm not withdrawing, or I don't have it. That's withdrawal. Then you figure out the symptoms. Never memorize the symptoms. Write this down. Pay attention to this concept. Write it down. The first thing you ask yourself, alcohol withdrawal. Do I see tachycardia? Do I see tremor, bradycardia, hallucination, dry skin, or pinpoint pupils? I will guide you. That's the concept. Write it down. After you pick your answer, I'm going to give it to you. You pick your answer. What do you think? This is straightforward concept. I want you to pay attention. Alcohol is a downer, so it puts you down. If you withdraw from it, you're going to go up because you don't have anything to put you down. Therefore, if I'm withdrawing, I'm looking for signs and symptoms that I'm going up now. Tremor, I'm going up. Bradycardia, I'm still going down. Hallucination, I'm going up. Dry skin, I'm going down. And pinpoint people, I'm going down. This is the way you answer these questions. And therefore, tremor, hallucination, signs and symptoms of alcohol withdrawal. Without even knowing the symptoms, I don't care. I just know the direction is supposed to go. A 28-year-old pregnant client is in preterm labor, maternity, health promotion, is being evaluated. Which prescription the nurse should anticipate? Pharmacology, maternity. These are medication for preterm labor. You see, I'm breaking it down as I go. That's how you do. You put in the concept together. So at the back of your mind, you know what you're supposed to do to pick the answer. Magnesium sulfate, prostine, ritodrine, calcium gluconate, methamphetamine. Rewrite the question. What is he asking? What medication do you use for preterm labor? That's all. What are we supposed to do? Stop labor, which causes contraction anymore. Therefore, which one? You don't have to select. If you know one answer choice, pick it. I know you're expecting one answer choice there. It's not there. Tubutalin is not there. There's a strategy. That's why you cannot just know that medication. I took that one off and I put a bunch of stuff that you may not be familiar, but you got to use the strategy. We got to slow down labor. Therefore, magnesium, good for slowing things down. Donepezil is prostaglandins. Prostaglandins, what does they do? They stimulate things. Wrong answer. It causes contraction. Ritodrine, drop things down. It decreases preterm labor. Therefore, it prevents contraction. Calcium gluconate is what? Antidote for magnesium sulfate. It does not help with contraction or preterm labor. And methyphenidate, what do you think? Ripene, right? Therefore, we don't need that. And then it's triaging phone call at the family medicine clinic. Prioritization. Like I said, random, like you see the NCLEX based on what you're doing. And this is the CAT exam, and you look really like the NCLEX. And then it's triaging phone call at the family medicine clinic. Which client situation require immediate notification to the ACP? That means what? Prioritization. Client report rash when outdoor after taking allopurinol. Should you worry about it? Client report orange, red urine color after starting rifampin. Client taking lithium report nausea and anorexia. Client taking sucralfate report last bowel movement 2 days ago. Always when they give you pharmacology prioritization, identify the medication, figure out if this is an expected finding. If it is, ignore it. You pick your answer? I know you picked the right answer. And the right answer, what do you think? It's lithium. If you take lithium, you have anorexia and nausea, that's toxicity. Allopurinol is a sulfur drug, but if you go outside and you have rash, that's photosensitivity. But if you have rash, small purple rash on your chest without not going outside, that's TB Johnson. So this is just photosensitivity. If you take rifampin, you're going to have all secretion turn orange-red in color. And sucralfate is a cement. It causes constipation. So no bowel movement for 2 days, unexpected finding. Therefore, lithium is the problem. And this is caring for a client who is now post lumbar puncture for suspected meningitis. We did lumbar puncture for suspected meningitis. Which of the following action should the nurse prioritize? It's prioritization by neuro prioritization. After lumbar puncture, what should be your priority? What do you want to prevent? Prevent complication, risk reduction. Therefore, think about it. Reread the question in your mind. Patient had lumbar puncture. We already done the procedure. We already know the patient has meningitis. Okay, question is asking you, what do you do after lumbar puncture? Place client in the airborne precaution. Assess the client for Kenning sign. Place the client in the supine position. Minimize oral fluid intake. What do you think? After lumbar puncture, what should be your priority? What? I can tell you. Lumbar puncture, and they go through the back here. They go through the spinal fluid and draw some fluid from the spinal canal, right? And they use it to test for infection. CSF. What is the problem? These can leak. Therefore, how do we prevent leak? Pressure. How do you apply pressure? Lay on your back. Therefore, laying in the supine position is the most important thing. Now, let's look at the other question. Meningitis, does it need airborne precaution? Assess the client for Kenning sign. We already know the patient has meningitis. Why do you want to do that? This is a trap. If you pick it, it's okay, but think critically. We already know patient has meningitis. After lumbar puncture, I don't need to assess for Kenning sign. You may be familiar to you, you want to pick it, but don't do that. You're losing the point. The question says, after lumbar puncture, I'm not assessing anymore about meningitis. I just want to prevent complication after lumbar puncture. Place the client in the supine position and then give them fluid. You should not minimize fluid. The client reports sudden onset of right pain. That means acute pain. Eye pain. There's photophobia. There's redness and there's scotomas. What diagnosis is most likely? Cataract, retinal detachment, acute angle closure glaucoma, or macular degeneration? What do you think? There's a way to answer questions relating to eye disorders. Always pay attention to the buzzword. And I want you to pay attention to pain. Ask yourself, which condition can cause pain? If it doesn't cause pain, eliminate it. Your chance of getting the answer right is correct. Common sense approach. Cataract does not cause pain. Macular degeneration, no pain. Now you have two problems. Retinal detachment, acute angle closure glaucoma. One, what does it do? You feel like curtain is falling over your eyes. That's retinal detachment. The question never said that. Therefore, this is acute angioglycoma. Number 9, delegation. A registered nurse and LPN are caring for a client in the med-surg ward. Which tasks are appropriate for the RN to delegate to the LPN? That means MMR most. And what is that? Most medication, monitor, reinforce, give most medication, provide stomach care, and tube feed, specialized tests. That's all. I see teaching. What do you think? Teach the client about newly prescribed lisinopril and hypertension. Administer oral lisinopril to the client. Reinforce teaching on use of enoxaparin. Check oxygen saturation with the pulse source, and then assess a new calf edema and erythema based on what I've told you. What should be your answer? What do you think? I cannot provide teaching. I'm an LPN. I can reinforce that teaching. I can give most medication. I can reinforce that teaching. Check oxygen saturation with the pulse source. Of course, I'm checking vitals with the pulse source. That's like UAP. There's no UAP there. I should be able to do that, right? Straightforward. Assessing a new thing, RN can do that. It's not my job now. Number 10, and this is assessing a client who has a history of opioid use disorder and has not used opioid for 12 hours. It means withdrawal. Which of the following findings indicate opiate withdrawal? I've given you the clue. Find what is opiate, put it in the box, and ask yourself, when you're taking opiate, what kind of symptoms should you have? And if you don't have opiate, what kind of symptoms are you going to get? I'm just showing you how to answer questions and a strategy to answer questions. Therefore, we know opiate is what? Is a downer. If you don't have it, you're going to go upper. Therefore, constricted pupil is smaller. That's intoxication. Constipation, I'm going down. I'm looking for something, I'm going up. Diarrhea, a muscle cramp, or aches, I'm going up. And respiratory depression, I'm going down. If you do it like that, no matter what kind of symptoms they give you, when it comes to substance misuse, you will figure out the signs and symptoms you need to know. And that is adapting NCLEX way. 10 questions. How did you do? I know you're doing well. If you are behind, stop the video, go get something to drink, take a deep breath. Like I said, I'm going to push you. I'm going to challenge you. I'm going to push you to the point that you will learn something by the end of this video. This is how your concept, NCLEX practice question, NCLEX questions and answers, designed to get you ready for your NCLEX. This is test number 21, and I know you will master this. By the end of this video, you learn something. Let's get to it. Number 11, pediatric newborn. You can't run away from it. Like I said, this is a catechism. It will feel really hard, but that is the way it's supposed to be. And this is assessing an 11-month-old infant in the pediatric clinic. Which finding below is concerning? Select or apply. When they give you a question, focus your head, your mind on 11 months and see what the kid can do. Presence of moral reflex. Should he be there 11 months? Babinski, should he be there 11 months? Poor suckling. 11 months should be having poor suckling. 10 wet diapers in the day. Is that okay for 11-month-old? Poor feeding. Is that okay? Crying when the caregiver leaves the room. Is that appropriate? And cannot sit unsupported. Do you think it's okay? This is the way at the back of your mind, when you read a question like that, it becomes easy. You said, okay, my brain is like following. It's not an abstract answer choice. What do you think? Pause the video, pick your answer, let me know. Presence of Monroe. I'm 11-month-old. Should this be there? He goes there. Yes. He stay up to there. What? When? When does he go? Do you think should be there? Says concerning. After 3 months, it should be gone. We still have there. I'm worried about it. Babinski can take up to 12 months to 15 months. That's okay. or cycling, you should be cycling well. Do you have neurological problem? It's concerning. 10 wear diapers a day, you were hydrated. Poor feeding, we have a problem. Crying when the caregiver leaves the room, expected finding for 11-month-old, separation, right? Cannot sit unsupported. By this time, you should be, after 6 months, you start doing that 8 months, you should sit unsupported. We have a problem. The questions say, concerning. Those are our answers. And this is providing discharge instruction to a client with what clostridial deficit infection, C-diff. Which of the following instructions should the nurse include? They're going home. How can they, you've taken care of them in the hospital. When they go home, they should not infect anybody. Wear surgical mask when outdoor. Laundering your undergarment with regular detergent. Family members should use alcohol-based hand sanitizers. And it's disinfect all surfaces with bleach. What kind of teaching do you provide them? It's a C-diff, infectious prevention, right? Infection control issue, safety, ankle safety issues also. What do you think? C-diff is a contact. Therefore, everything has to be clean. You don't wear surgical mask. Your garment, contact. We got to make it clean. Detergent is not enough. Bleach is going to kill it. Family members should not use hand sanitizers, soap, and water. Therefore, disinfect all surfaces. That's your right answer. This is a hard question, but it's a pharmacology. If you don't know, stop the video, write this concept down. Next time when you see it, remember, Adapter NCLEX got your back. What do you think? And this is caring for a client with type 2 diabetes who has been taking metformin for the past 6 years. The client reports new onset fatigue and numbness and tingling in the hands and feet. Which assessment should the nurse prioritize? Serum creatinine level, vitamin B12, hemoglobin A1C, fasting blood glucose level. Don't get trapped. Pay attention to the bars rate. If you figure out all the answers may be right, but it may not answer the question. Did you pick your answer? I want to know what kind of answer you pick. Just put down in the comment and let me know for question 13. But this is the way I'll approach this question. I'm going to underline the buzzword. Type 2 diabetes. I'm on metformin. I've taken it 6 years, a long time ago. What is the problem? Fatigue and numbness and tingling. This is neurological problem. Therefore, I know something is causing neurological problem, peripheral neuropathy. It's not true peripheral neuropathy, but it's due to something causing it. You know, diabetes patient may have this problem, but this is a new onset. It should be what? You got to rule out something. Serum creatinine, what? You may have what? Lactic acidosis. If your kidney doesn't function and you take metformin. B12 deficiency, yes, can cause peripheral neuropathy. Hemoglobin A1C will tell me your diabetes is not controlled. Your fasting glucose level, it will tell me your glucose is not controlled. What is the key? Metformin lead to decrease in level of B12, and patient may have accelerated peripheral neuropathy. Therefore, pay attention. One of the major side effects of metformin, apart from lactic acidosis, if you take it for a long time, you have B12 deficiency. This patient may need B12 injection. Know this concept. Next generation NCLEX. This is a board type question. Don't worry, I got you. If you're tired, take a breath, come back. I want you to pass this one. This is the question. They will give you a lot of it. Don't worry. Pay attention to the buzzword. Client admitted with what? Increased irritability. What is going on with the kid? A leaking gastrostomy. So he has G-tube, look like irritable. Does he have infection? Which was placed 2 weeks ago for failure to thrive. That means he was not able to eat, not growing. They placed a G-tube to feed them. The feeding tube insertion site, which is on the left side of the abdomen, is covered with the dressing that is saturated with what? Old formula. That means it's leaking. Is it infected? I don't know. On removal of the dressing, the skin surrounding the feeding tube site is erythematous and flanking. That means infection. At the insection site, a small amount of thick yellow drainage is noted, and the feeding tube is loosed. Infection. Peripheral pulses are weak. Patient may be dehydrated. Capillary refill is 3 seconds, borderline. Extremities are cold to touch. Dehydration. Client is intermittently pulling at the tube because he may be infected and scratching at the site. I'm showing you how you read case study. As you read, you connect it to the beginning and see what you suspect is going on. Patient report giving the client acetaminophen. They suspect pain at the site, right? Last night before bedtime. And the client was still pulling at the tube and scratching at the site. Parent report giving the client acetaminophen last night before bedtime, but the client was still intermittently waking and irritable throughout the night. Parent attempted to feed the client through the feeding tube 8 hours ago. Temperature slightly elevated. Patient is 171. Pulse. Respiratory rate 42. Blood pressure is low. Look like sepsis or not, but you got to figure out how old is the kid. Pulse is like that. Parent has a history of what? Penicillin allergy. But they did not tell you if the patient has a penicillin allergy. Therefore, what do you think? Signs of infection in the kid who have gastrostomy. Therefore, the nurse is reviewing the clinical assessment data to prepare the client plan of care. Specify whether the condition the client is most experiencing. Is this refeeding syndrome because patient is malnourished and we're feeding the kid? Infection of the gastrostomy tube site. Is this a normal gastrostomy tube finding if the kid is pulling on it as pain? And this is what intolerance to gastrostomy tube feeding. There's no diarrhea. There's nothing indicating the kid is not tolerating anything. He's having fever. He's having pain. Keep on pulling on the tube. This is what? Infection. If this is an infection, what would you do? Change the site dressing, request a wound consultation, give a bolus because patient is dehydrated a little bit, get an echocardiogram, reassure the parent that the findings is normal healing process. You know it's not a normal healing process. What are we going to do? Change the site. Wound care. Why would you want to call wound care right now? Request bolus and obtain echocardiogram. So let's see what we have here. So we know this is an infection of the gastrostomy tube site. Then 2 actions the nurse should take to address the situation. We're going to change the site and we're going to give the kid bolus because patient is dehydrated. Based on what we have here, we have to give the kid fluid because we suspect sepsis. Now, 2 parameters the nurse should monitor to assess the client. Now we know the patient has sepsis. 2 parameters the nurse should monitor to assess the client progress. What do you think? Stool output, skin integrity, feeding intolerance, vital signs, parent ability to administer tube feed. If you know patient is septic, you got to check their vitals. And then you got to clean the area to make sure there's no more infection. Skin integrity. This is bow tie. Therefore, how do you answer this bow tie question? Find the condition the client is suffering from. If you find it, use actions to fix the problem. And the action that you take, make sure you follow up on the parameters. So this is the case with infection of the G-tube site. We took care of it. We give the kid fluid. We change the site. And then what do we have to look? Look for skin integrity so that it doesn't get infected. And then we monitor the vitals, make sure the kid does not progress. Number 15. A nurse provide care for a client with serum creatinine of 2.3. Which prescription in the order sheet the nurse should question? Select or apply. Creatinine of 2.3, renal insufficiency. You should not give them any medication that will affect the kidney. Indomethacin, Borac, acetaminophen, aminoglycosylate, vancomycin. Which of these should you not give to a patient who has renal failure? You pick your answer. I can tell you NSAID right away. You should not give it to them. This is another NSAID. Acetaminophen is okay. Aminoglycoside affect your kidney, and vancomycin, that's the same thing. This the patients to avoid. 15 question. How did you do so far? What is your score? I hope you're above 60% so far. We have more to go. Grab a pen and paper. Write all these concepts. If you're tired, get something to drink. Come back. Let's finish this. These NCLEX practice questions are challenging, but I know you're going through safely with me. 16. Maternity. A nurse is administering Pitocin to induce labor. Which finding indicates the need to stop the infusion? That means bad things is happening. If I give you Pitocin, it can cause tachycystoly. It can cause overcontraction. You have to know these numbers. Which numbers do you think you should know? Contraction lasting 60 seconds, fetal heart rate of 90, contraction every 3 minutes, resting tone 100, fetal heart rate decrease as soon as uterine contractions start. What do you think? You pick your answer, you pause the video every time to select your answer so that you know that you're learning something. Then as you listen to the explanation, you know how you make a mistake, you can correct it. Which one? Contraction less than 60 seconds is good. We want it to be less than 90. Fetal heart rate of 90, that's bradycardia, bad problem. Contraction every 3 minutes. That means there's an interval for you to relax. So that's good. Resting tone over 80 is a problem. And fetal heart rate decrease as soon as uterine contraction starts. This is early deceleration. Early deceleration is head compression. It's okay to proceed. No problem. The client present with what? Weakness in both legs. 1 week after what? Flu-like symptoms. That's the key. Flu-like symptoms, and all of a sudden your leg is not working. On assessment, it cannot move its upper extremities. So your leg is started from your leg, ascend to your upper extremities after what? Flu-like symptoms. I'm giving you a clue. What do you think? Which assessment finding should there be the highest priority for the nurse to report to the healthcare provider? Severe leg weakness, decreased deep tendon reflex on both legs, slurred speech, and numbness and tingling of both hands. You pick your answer? I can tell you this is GBS. Ascending paralysis, lower leg weakness, upper extremities weakness, after flu-like symptoms, that's GBS. Your priority is your airway. What is your airway? Dysphagia and changing voice, slurred speech, severe leg pain, decreased tendon reflex, numbness and tingling, all expected. If I see slurred speech, you are in trouble. A nurse manager is developing an orientation plan for new nurses. Which of the following topics should the nurse include in the plan? If you want to be a new nurse, go to an hospital. What topic do you want to know? That's all. Computerized charting, scale proficiency, policy and procedures for the facility, socialization into the unit culture, assignment to the preceptor. What should be most important to you? You don't have to select everything. Think about it. If you're a new nurse, you show up on the floor. What do you want to know to survive in the unit? You got to know how to chart. You got to be proficient. You got to know policies, when you need to do, if something happening, which procedures you should file. Hey, how to get together in the unit. And then who's your preceptor? All of them indicated. This is management of care. You have to master them. Like I told you, this goes everywhere. Management, every portion of the NCLEX. What steps the nurse should take using the following action? All steps must be used. A new graduate discovered that the client was administered an anti-diabetic medication in error. Wrong medication. The name of the medication does not matter. I give you wrong medication. What do? Do I complete incident report, check vital signs, notify the provider, notify risk management, instruct the client to remain in bed? What do you think? I give you wrong medication. What steps would you take? This is a safety, NCLEX safety question. You made a mistake. What are you going to do? First, see if the patient is in trouble, vital sign. Tell them not to get up because they may be hypoglycemic. And then let the doctor know. Complete your incident report and let the risk management know. This is the way you should do if there's an error. Number 20, NS care for a client with a new diagnosis of heart failure who require assistance with medication. Which interdisciplinary team member the nurse should consult for medication management and socialization? You know interdisciplinary team member. You know what each person function is. Don't overthink it. Pick the one that will help with what? Consult with the what? Medication management and education. Don't overguess it. What does the social worker do? What does the pharmacist do? Discharge planner, what is their function? Healthcare provider, what do they do? Who is going to help with what? You got to consult them with medication management and education. Of course, he has to be the pharmacist. That's what they do, medication. The social worker and the discharge planner work together, provide everything you need to know. But in terms of medication management and education, they are not involved. The doctor prescribes the medication. Two nurses argue about who should take responsibility for a client critical lab results. Conflict resolution, management problem. You see, I'm taking you things you've never seen before, but this is the comfort level challenging you, right? What should the nurse, charge nurse do? Conflict resolution. What would you do? They want to know who take responsibility for the critical lab work. Assign responsibility to the nurse who was assigned to the patient that shift. Allow both nurses to explain their perspective, then help them agree on a resolution. Document the argument and escalate it to the upper management. Provide a written protocol on lab results responsibility. We want something now. What do you want to do? If you want to resolve conflict, then both of them go at it, come back together, and then help them resolve it. You cannot assign responsibility to the one who was assigned today. That's not good. You should not escalate it to the upper management. Figure out what each one wants, why they're arguing, and then help them resolve the problem. Conflict resolution. And this is evaluating outcome of what? Intervention to promote ethical principle. What is ethical principle? That's the buzzword. Which outcome indicate effectiveness? The nurse make decision for the client. The client participate in the care decision. The family direct care for the competent client. The nurse avoid discussing treatment option. What is the principles of ethical practice? And I'm giving you the concept. It means autonomy, self-decision making. Which of these ensure patient has autonomy and make self-decision? That's all. He participate in the care of a decision. That's the right answer. Nurse making decision for the client, that's no autonomy. Family direct care, that's no autonomy. Nurse avoid discussing treatment option. You can't ignore the patient in the treatment management. So ethical principle in terms of autonomy be indicated appropriately. A nurse is caring for assigned client assignment. The nurse should first what? Assess a client, what? Prescribe glycogen who want to eat breakfast, prioritization. Assess a client with AFib who has what? Irregular heart rate of what? A pulse of 85. Assess a client with diabetes who's diaphoretic and shaking. Assess a client with bipolar who is pacing in the airway. NCLEX prioritization, NCLEX priority, patient prioritization. Which one would you see? Who should you see first? You pick your answer, you stop the video. I can tell you, this patient is hypoglycemic. We need to see them. Bipolar patient, pacing, nothing wrong with it. AFib, you're going to have irregular heart rate, but so far as your pulse is well controlled, 85 is good. Glycogen is a long acting. You don't need me to give it to you before you eat breakfast. You can eat breakfast without. Therefore, number 3, diaphoretic, shaky, diabetes is hypoglycemia. We got to do something. The client told the nurse, there are people outside recording my conversation. What is the next best response? Therapeutic communication. Patient said he can hear people recording their conversation. You think something is wrong. What are you going to say? When did you first start feeling there are people recording your conversation? Can you show me the people you are referring to? Try to ignore them. They are not real. Your eyes are playing trick with you. Therapeutic communication, best way is ask for more information, which answer choice is asking for more. Ignoring them is not asking for more. Can you show me the people who are referring to you are enforcing that hallucination or perception? Wrong answer. They are not real. You should not fight the reality. It's not your job. You tell them what you see. Therefore, ask them when the first time they feel like people are recording them, and they will tell you more information. And this is preparing chemotherapy in a clinical setting. Which of the following action by the nurse is inappropriate? Select or apply. Chemo agent, they are toxic, teratogenic, hazardous chemicals. How do you handle it? Safety, use a mask with a face shield. Priming IV tubing with chemotherapy solution. Using a closed system transfer device. Flush the IV line with normal saline after extravasation. Disposing PPE in a designated chemotherapy waste. Which one is inappropriate? That means doing something bad. Chemo agent, it can splash, wearing masks in your face. Nothing wrong with it. Using a mask with the face shield is protective. It helps you. Nothing wrong with it. Priming IV tubing with chemo solution, it will aerosol. It may spill. You get into trouble. You should not prime it with the chemo solution. Use a closed system transfer device. Prevent exposure. Flush the IV line with normal saline after extravasation. When you flush the IV line after extravasation, you spray the chemo agent and causes more necrosis. It's supposed to stop, leave the IV in, aspirate out, and then inject antidote, not IV fluid. Wrong answer. And chemo agent should be disposed in a chemo designated waste. That's the right answer. And this is orienting news graduate to the med-surg ward. Which of the following the nurse will include when discussing SBAR, SBAR? You have to know the meaning of SBAR. What is that? Is it situation background assessment recommendation, situation background assignment recommendation, service background assimilation recommendation, survivor behavior assessment recommendation? This is situation background assessment and recommendation. That's SBAR. And this is caring for assigned client. The nurse you initially follow up with the client who has what? Patient has received beta agonist 1 hour ago, reporting what? Palpitation. Has had what? Pericarditis, chest pain, only relieved by leaning forward. Has chest tube connected to suction with no bubbling in the collecting chamber. Agonist 1 hour ago and now reporting palpitation. Has pericarditis reporting chest tube only relieved by leaning forward. As chest tube connected to suction with no bubbling in the collecting chamber. Now post-transvenous hypophysectomy with the clear nasal discharge. Which patient is in trouble? Whose situation is bad? Pick an answer, stop the video, pay attention to the condition. I can tell you, D is the right answer. This is pituitary surgery, clear nasal discharge is CSF leak. This can develop meningitis. If you have chest tube, and there's no bubbling in the collecting chamber, there shouldn't be any bubbling. That's good. Pericarditis, you can have pain, chest pain, but it can be relieved by leaning forward. That's good. If you have beta agonist 1 hour ago, you're going to have palpitation. And therefore, the right answer is D. That's patient we should see. 38. A client with NG tube has been experiencing frequent what? Episode of nausea and vomiting. Which nursing intervention should be prioritized to assess and manage this issue? The key thing is NG tube experiencing episode of nausea and vomiting. If you have NG tube, you should have no nausea and vomiting. That's something is wrong. Check the tube feeding formula. Check the tube for a kink. Administer antiemetic and decrease the rate of enteral feeding. Something should be wrong when I'm feeding you through a NG tube. You're having nausea and vomiting. What do you think is the most likely problem? You pick your answer. Think about the situation carefully. If you look at it in isolation, you may get it wrong, but think about it. Changing the formula will not change anything. Mostly formula will lead to diarrhea. Something is blocking you. That's why you're vomiting. This may be a kink. Antiemetic is treating the situation, not trying to find the problem. Decreasing the rate of the enteral feeding has something to do with what? Diarrhea, not nausea and vomiting. And this is caring for a client with tonic-clonic seizure who is taking what? Phenytoin Pharmacology. Which assessment finding require immediate notification of the healthcare provider? That means, what do you know about phenytoin that you should intervene? Horizontal nystagmus, gingival aplasia, small purple rash on the chest, unsteady gait. The signs and symptoms of phenytoin, because it's a sulfur drug, is a anti-epileptic that you should know. And there's some that are very dangerous. You pick your answer. I can tell you, small purple rash is Stevens-Johnson syndrome related to sulfur drug. Horizontal nystagmus, expected finding, ataxia, gingival aplasia. We give you some folate deficiency and antibiotic and mouthwash, and this will help with that. Unsteady gait associated with the medication, but it's not a major side effect compared to small purple rash with Stevens-Johnson syndrome. Question 30, NGN. What do you think? Don't worry, I got you. Highlighted information. And then she's talking to a client prescribed what? Dabigatran, anticoagulation for what? Venous thromboembolism. Client report of the following due to the new prescription. He's drinking 2 to 3 liters of water a day because he's been prescribed Dabigatran. Client has stopped taking fresh leafy vegetables. Client is using razor blade for hair clipping. The toothbrush is bristle in nature and has a lead bracelet on. Client takes what? Psyllium, Motrin, and prednisone daily. Client is engaged in contact sports. Recently, client started oral contraception due to what? Medication. What do you think? And I said, which allied statement need further teaching? Patient is doing all this thing because of dabigatran, anticoagulation. This is direct what? Factor 10 inhibitor. Should we intervene because they think they're doing something wrong? Hey, drinking 2 to 3 liters of water a day is good. It prevents DVT. But you should not stop fresh leafy vegetables. It does not affect diet. Use razor blade for hair clipping. You're going to cut yourself. Use what? Clippers. Your toothbrush is bristle. That's good, right? Prevent bleeding. You have a lead bracelet on. We know that means you're taking anticoagulation. Psyllium prevents constipation. It's a fiber so that you don't bleed from the anticoagulation. If you take Motrin, you're more likely to bleed. Prednisone, you're going to bleed because it's ulcers. Contact sports, you're going to bleed. And oral contraception, that's not what? Oral contraception due to the medication. Why would you take dabigatran and then say you need oral contraception? It's unrelated. So we got to intervene. That's a problem. And this is in a scene of multi-trauma. This is triaging. Prioritization. Bring your concept on prioritization. Which client does the nurse see first? Client with obvious leg deformity. His leg is broken, reporting of severe pain. A client reporting chest pain. Client unconscious with obvious tracheal deviation. Client with traumatic amputation and dry blood at the stump. There's a way you can master what? Triaging. These triaging questions are very tricky, but you got to limit yourself. Always look for the red. The black patient, destroyed. Black patient is somebody who is severely injured, and you'll be tempted to pick it. Severe injured and dead, we don't have anybody. But if I have unconscious and a tracheal deviation patient, it may be because they have what? Tension pneumothorax. If you relieve the tension pneumothorax, they're going to come back. This is a red patient. Reporting chest pain alone is not enough. Like deformity with severe pain, you have time. But this patient has no time. Amputation patient is no more bleeding because there is dry blood there. Therefore, this patient is somebody we're going to see. And next is provided teaching to a client with what? Moderate insomnia, sleeping issue. Help me out to sleep. That's all. Which of the following the next you include in the teaching? How do you help this patient sleep? Avoid caffeine before bedtime. Keep room temperature cool and noise free. Avoid reading in bed. Engage in moderate exercise 1 to 2 hours before bed. Take nap during the day. Go to bed and wake up every day at the same time. Trust me, no matter wherever you go and do this English practice question, wherever Q bank you take, if you see a sleeping question, these are some of the things they will ask you. Insomnia is the same strategy. Therefore, I hope you're going to master it. I hope you're going to master it. You should avoid caffeine because you're not going to sleep. Keep the room temperature cool and noise free. Cooler is much better. Warm, you can't sleep. You shouldn't read in bed. Your bed is not the library. You should be reading in the chair. When you're ready, you go to sleep. There should be no what? Moderate exercise 1 to 2 hours before you go to bed. If you have maybe 4 or 5 hours before. Don't take nap during the day. You're not going to sleep at night. And then have a routine. Go to bed at the same time and wake up at the same time. Those are the sleeping hygiene. And these are some of the information you can take picture. And this is what they will ask you every time they give you a sleeping question. This is coming. Which of the following client can the RN safely delegate to LPN? We saw it, MMR most. This is delegation question. Client with multiple sclerosis needing assistance with ambulation. Can the LPN take care of them? Client with suspected stroke presenting with facial droop and slurred speech. Client with osteoarthritis requiring scheduled oral pain medication. Client with postpartum hemorrhage soaking pad every 15 minutes. Do you think that patient is stable? Client with stable colostomy needing routine stomach care. And a client with hypothyroidism in mesothelioma coma requiring IV levothyroxine, who is stable enough to be given to LPN. If you have hypothyroidism and you are mesothelioma coma, that's emergency. No way. But a stable stomach that needs stomach care, that should be fine. That should not be a problem. Postpartum hemorrhage soaking pad every 15 minutes unstable. Osteoarthritis requiring scheduled medication. LPN can give most medication. Stroke patient, facial droop, slurred speech require ongoing assessment? No. And multiple sclerosis patient, you just want to walk. We should be able to give it to them. And this is assignment to experienced LPN. Don't get disturbed. Experienced LPN, still your scope of practice is an LPN. So pick an answer choice about LPN. Don't over-select because then when you see experience, you think they have to do big things. No, they just do the same thing as LPN. Which of the following are appropriate to delegate to the LPN? Client with COPD who needs scheduled inhaler. Client 2 hours post-mastectomy requiring initial wound assessment. Client with diabetes mellitus who need routine insulin administration and blood glucose check. Client with new onset confusion and fever requiring IV antibiotic. Client on warfarin therapy who need education about dietary vitamins. Client with stable hypertension who require reinforcement of medication adherence. LPN, stick with it. Don't change your mind. What do you think? COPD patient, stable. Most medication, they can do that. Initial wound assessment has to be done by the RN. Diabetes patient routine insulin administration, should be able to do that. New onset confusion and fever requiring IV antibiotic need assessment. On warfarin therapy, we need education by the nurse. Stable hypertension, reinforcement, LPN can take care of it. 35. How are you doing so far? If you're tired, take a break, go get something to eat, warm yourself up, and come back and let's finish this 85 question, because these are high yield English practice questions, English questions and answers, English practice test. These are really, really important questions you want to master. A client with schizophrenia is prescribed clozapine, mental health concept, psych nursing. Which finding require the nurse immediate action? That means you got to do something. Sedation and drooling, weight gain and constipation, sore throat and fever, dizziness when standing. If I take clozapine, which of these should bother me? Which of these should worry you? It's an antipsychotic. There's certain things you should be concerning about. Pick your answer, stop the video, let me know, put down in the comment, and then also comment where you're watching from, wherever you are, whichever part of the world you are. I want to know, just put it in the comment and tell me, hey, I'm watching from USA, India, wherever. Put it down and let me know. And I'll give you high five. Clozapine, second generation antipsychotic. What is the major problem? Agranulocytosis. Do you see agranulocytosis? Infection, sore throat and fever, bad problem. Weight gain and constipation, expected finding. Dizziness when standing, orthostatic, expected finding. Sedation and drooling is hypersalivation. I'm not picking it. 36. A client arrived in emergency room with mesothelioma coma. That means severe hypothyroidism. They are in shock. They're dying. Everything is going down. Which assessment finding the nurse is most concerning about? Respiratory rate of 12. Blood pressure of 57 or 45. Temperature 95. Confused and does not follow command. All of these are bad. But which one is bad? The baddest of all. There's no word for baddest. But think about it. Everything's going down. The place you should worry about is their heart. When they are in shock, everything stops. Therefore, I worry about their blood pressure. The respiratory rate of 12 is not that bad. Even though they're confused, they don't follow command. Neurological is because they are in shock. The blood pressure is too low. Next generation NCLEX. Like I told you, I'm taking you up and down to challenge you. Challenge you. Because I know I want you to pass your NCLEX. And this is provide district teaching to a client with type 1 diabetes who's been prescribed insulin pump. Do you know anything about insulin pump? Write it down. If you're not, try these answers. Then take a pen and paper. Listen to the way I'm going to answer them. And whenever you see a question, that's what they're going to ask you. Trust me. Which client statement indicate effective understanding of the teaching? I should rotate my infusion site regularly. Is that what you do when you have a pump? I will change my infusion set every 2 to 3 days. I will keep a backup supply of insulin in my car. I will load my glargine insulin into my pump. I will check my blood glucose less often now that I have a pump. What do you think? Insulin pump, how do you manage it? What are the concepts you should know? You should rotate it. Effective. You should change the infusion every 2 to 3 days. Effective. Insulin should never be kept in the car, right? Heat. They don't like heat. Therefore, not effective. Insulin pump, the only thing that goes to insulin pump is fast acting and short acting, not long acting, because it's used for what? Before you eat. It regulates your diet when you're eating. Therefore, long acting, we don't put it in it. Insulin pump, ineffective. Despite the pump, you still have to check your glucose. These are the things the patient does not know. Ineffective. So those are the things, pay attention to that. Pediatric. They come in whether you like it or not. It's part of what? Health promotion, maternity, newborn, pediatric. The pediatric nurse observes several children playing by talking to each other, number one, and playing the same toy, each other, same toy, but they're doing different things. Pay attention. Which of the following play the nurse should document? It is parallel play, solitary play, corporate play, associate play. You have to know the definition. I've given you the definition here. The children are playing. They're talking to each other. If this is the one kid, that's another kid. They're communicating. They're playing with the same toy. So they are not parallel to each other. Parallel to each other, I'm playing here, you playing here. I'm playing beside each other, but I'm using my own toy. You cannot touch my toy. So this is gone. Solitary play, I'm playing alone. This is they playing along each other. Therefore, it can be. But doing different things, right? There is no leadership. They never mention anything about leadership. Therefore, it can't be corporate. It has to be associative play. This is an example of associative play. The nurse is caring for a client in the ICU on tracheostomy collar. That means there's a trach care. Which action by the nurse is appropriate? How do you take care of the trach? Suction the tracheostomy every 1 to 2 hours. Apply suction when inserting the catheter into the tracheostomy. Provide warm and humidified oxygen. Wear clean gloves during suctioning. What do you do? Which answer choice you pick? This is safety question, infectious control, infectious disease regarding tracheostomy management. You pick an answer? I can tell you, right answer is warm, what? Humidify oxygen to allow better absorption and prevent drying of the trach. You don't suction people just because they have trach every 1 to 2 hours. It's not scheduled. You suction them if they need it. Signs of a respiratory problem. And when you're suctioning them, there's no pressure applied when you're insecting. So no suction applied when you're insecting the catheter. It's a sterile procedure. Clean gloves is wrong answer. Number 40. How did you do? Let's get to it. This is cranial nerve. Are you afraid of it? No, you watch adapting class because I know you master it. I have a video I released recently on cranial nerve. It talks about everything you need to know. I want you to watch it. You'll be more comfortable. But this question, I will give you the strategy. It may be hard, but you know it. You can eliminate other answers. A nurse is performing a morning assessment on the client admitted to the neuro unit. The nurse asks the client to swallow one and then say a word. So speech and swallow. Which cranial nerve is involved with speech and swallow? Cranial nerve 5, cranial nerve 7, cranial nerve 9, and cranial nerve 10. What do you think? 5 is trigeminal, sensation of your face. 7 is facial, movement of your face. Therefore, none of them is involved in speech. 9 and 10 are involved in speech, but which one is involved in swallowing? 9. So swallow and speech is 9. Speech alone is 10. Pay attention to that. Neurology question. You've seen these videos before, on these pictures before. You've seen some questions like that. This is how they can portray it for you. And this is assessing the client in ophthalmology clinic for acute left eye pain. All of a sudden, the eyes is hurting. Based on the image assessment, which condition the nurse should suspect the client is most likely experiencing? This is your normal vision. And 9 hours. Seeing everywhere. I can see everywhere. Beautiful. What do I see? Here. You see all these dots? You see all these flashes? You see half of the vision is gone. Pay attention. This is normal. This is the individual. Normal. Individual. Why do I see all these spots? This line here covering half of the visual field, and there's what? Flashes here. These are floaters. I'm giving you a clue. Floaters, flashes, and half of the visual field is gone. It can be cataract. I'll show you a lens. Macular degeneration, central vision will be gone. The central vision is still there. Close angle glaucoma, you're going to have peripheral vision will be gone. You can see some of the peripheral vision. You can see this is like a curtain. It's falling down my eye. This is retinal detachment. If you can figure out, look at it again, go back to the key concept, you can see this is curtain falling on my eye. That's retina. The floaters and flashes. Retinal detachment. Another next generation question. This is a bow tie question. 60-year-old was brought to the emergency room by the daughter after sudden onset of difficulty word finding, speech problem. There's a slurred speech. Number one, facial droop. Now I can't move my face. I have left-sided weakness. I'm weak on one side. What is the going on? Fast. Symptoms onset is 2 hours ago. These are my vitals. Tachycardia, temperature is normal, blood pressure is elevated, my glucose is 80. I'm confused. S1, S2. I have irregular rhythm. Probably that's what causes the problem. My abdomen is fine. I have positive pronator drift. That means if you stretch your hand and you open your palm up, facing up, before you realize your palm will be facing down. Positive pronator. One of your leg is weak and there's no sensation. You have AFib. If you put it together, go for the buzzword. 60-year-old, slurred speech, facial drooping, left-sided weakness, acute onset, AFib, should tell you something. What condition the client's experiencing? Bell palsy, ischemic stroke, transient ischemia, hypoglycemia. It can be hypoglycemia because glucose is 80. It can be bell palsy. I will tell you just one phase. The body is not going to be affected. Transient ischemia, I would say curtain is falling over your eyes. Therefore, this is classic ischemic stroke. If this is stroke, what am I going to do? Get a head CT, protect the patient airway, give them steroid, and give them glucose. Think about it. If it's hypoglycemia, you get glucose. If it's bell palsy, you get steroid. Therefore, if I have to pick two, it's the first two. At CT, protect the airway. Now, what two parameters am I going to monitor? Their GCS, their sugar, bleeding during therapy, or eye pain. They're not having eye problem because this is not bell palsy. If I ischemic stroke, they may need TPA, therefore they're going to bleed. And therefore, I have to worry about GCS and what? Bleeding during therapy. Both type question, NCLEX practice question, NCLEX case study, next generation. You see how I solve it. Don't stretch too much. Know the way you can tackle them, and you can see that it become easy for you. I'm not done with you. Like I said, I want to challenge you. I want to poke you, and I want you to feel it. By the time you finish watching this video, you learn so much. You said, oh, what this video has done to me. Same thing. Next generation NCLEX. Back to back. 65-year-old female with the left lower quadrant pain, nausea, bilious emesis, non-bilious emesis, and hematochezia. These 4 words should tell you, 65. What is in your left lower quadrant that can cause pain, nausea, and vomit? I have fever, connected together, heart rate, tachycardia, right? On the exams, I have left lower quadrant tenderness to palpation. The rest of the abdomen is fine. That's the first patient. Multiple patient prioritization is what the NCLEX is now asking. It's like prioritization question, but then you got to work through them. What do you think is wrong with A? 45-year-old, he has cirrhosis of the liver, increased dyspnea and abdominal distension. Cirrhosis, probably ascites. Now you're having respiratory problem. There's temperature, 101.5. Is the ascites infected? I'm tachycardic, right? Scary ectric, expected for the liver disease. Is labored breathing, probably at ascites, tachypnea, clear breath sound, right? So what is wrong with the B? C, 29-year-old college student with a sore throat, fatigue, arthralgia, chills for 2 days after a night out. Went out, now he has UR symptoms. He has left upper quadrant pain this morning. Temperature 100, heart rate 99, blood pressure is okay. What do you think is going on with this patient? This patient has left lower quadrant, tenderness, fever, nausea, and vomit. This patient has what? Liver disease, ascites, probably is now infected, and have shortness of breath. College student went out overnight, have found now having UR symptoms and left upper quadrant pain. What do you think is going on? Which patient should you see first? I can tell you this patient is in trouble. C is in trouble. And C is what? Mononucleosis. It may have perforation. This is mononucleosis. They may have perforation of their spleen. A is diverticulitis, and B is what? Spontaneous bacterial peritonitis from ascites infection. Therefore, we're going to see C. Now, select 3 findings that is concerning for B. What is wrong with B? This is where I want you to master them. You see, I moved from C now. We were talking about B. You got to figure out what is wrong with B, right? So if you do that, the NCLEX is designed to test your brain how to stay focused. Like you're taking care of 3 patients. Now, something happening to B. What do? I look at B, increasing dyspnea, abdominal distension, temperature is high, right? Saturation, 98, it's okay. He has a respiratory that is labored, tachypnea, breath sound, is distended abdomen. So what is the problem? I don't like his fever. He has shallow breath, clear breath sound is fine. His heart rate is 104, tachycardia. I don't like it. His jaundice is normal because he has liver failure. He has history of a cirrhosis, and I'm not going to change anything. Therefore, it's not concerning. What is the intervention should the nurse include in a plan of care in C? C, I told you, is what? Mononucleosis is going to rupture his spleen, and therefore, we should get a CT scan. We should check CBC, make sure it's not already ruptured. We don't need paracentesis. It may need blood, so 18 gauge peripheral IV. We don't need to give him beta blocker, and we need to prepare for surgery in case you already ruptured. This is the key aspect of it. Client A, diverticulitis. What are you going to do? Nothing by mouth. CT scan of the abdomen, type and cross, colonoscopy, enema, IV antibiotic. You see what I'm doing? I'm trying to take you left and right, so that you can figure out what you need to do. This is the way the multiple case study. When they give you a patient, just focus on them. Don't worry about the other one. You know this patient has diverticulitis. What do you do for diverticulitis? Don't eat anything. Get a CT scan. We don't need to transfuse them blood. We don't need colonoscopy. We don't need enema. They will need antibiotic. You see, that's the key. If you give them colonoscopy, they perforate. If you give them enema, they perforate. They don't need blood. They don't bleeding. Which of the following order the nurse should prioritize? You know, B is bacterial peritonitis, right? Infection of the ascites. Therefore, if you have an infection, do I give you what? 25% albumin? Do I give you what? Anti-infective? Do I use paracentesis, sequential compression device, or cisp of clear? Which of these orders should the nurse prioritize? Which one? What do you think? Of course, we're going to give you antibiotic. Patient will need a SCDs. He's just laying there. Because of the respiratory status that is being affected, they will need paracentesis. And after the paracentesis, they will need infusion to help with the loss of fluid, albumin, not IV fluid. So that's what you give them. Now, client A is ready for discharge. Who is client A? Diverticulitis patient. What are you going to do? Which teaching is appropriate? Drink 2 to 3 liters of water a day, moderate exercise 3 times a week, daily Miralax, prescription for Cilium or adalimumab. What do you give a patient who has diverticulitis? What are the things do you do? Drink a lot of water, exercise. You don't need to give them Miralax. You give them Cilium to let them go to regular bowel movement. They don't need what? Adalimumab, because it's not immunomodulator. And this is the way you solve this question. Very, very important. This is the way you have to think about them. When you go back and you're watching them, think about each situation, who they're talking to, and what you need to do for each of them. A client with advanced lung cancer is experiencing severe pain, being on a prescribed opioid regimen. The nurse should prioritize which action: increase the frequency of opioid administration without consulting the healthcare provider, assess the client pain level, and consult the provider for possible dose adjustment, encourage the client to use non-pharmacological pain relief method, switch the client to a non-opioid analgesic for pain. This is very important. If you have lung cancer, advanced, that means end of life care, comfort is the best. And they're already on opiate, it's not working. What are you going to do? Assess the client pain and call the doctor for possible adjustment. You can't make your own adjustment. They should not use non-pharmacological. This is a different kind of pain. This pain, non-pharmacological, does not help. 45. A nurse is practicing in an outpatient clinic, is caring for a client recently diagnosed with what? Hyperthyroidism. Which diet-related teaching should the nurse include in the client plan of care? Hyperthyroidism. What is the problem? Everything is going up, except your weight is going down because everything is hyperdynamic. Therefore, how can we help you? Choose high-calorie diet and snacks between meal. Increase your fluid intake to at least 2 to 3 liters of water a day. Avoid food and drinks high in caffeine. Follow a low-protein diet. Increasing iron-rich food like shellfish and seaweed. What do you think? Stop the video. Pick your answer. Hyperthyroidism. Their thyroid hormone is very high. If you give them iodine-rich, they're going to make too much thyroid hormone. They need more protein. They should avoid caffeine because they already have it. They need to drink a lot of water. And then high-calorie snacks. This is to help them. 46. A nurse is educating a client about taking warfarin. What do you tell the patient? Which statement indicates further teaching is needed? They're saying wrong thing. I will stay on consistent amount of fresh living vegetables. I will take aspirin if I have my pain, any pain. I will use electric shaver to avoid cut. I will have a regular blood test to monitor my medication. If you're taking warfarin, what do? You got to check your lab. You should avoid injury. Electric shaver is much better. You cannot take aspirin because you're going to bleed. Consistent amount of fresh living vegetables. You should not stop it. Consistent amount. The next is assessing a client with new diagnosis of hypothyroidism. Everything is going down except your weight. Which symptoms should the nurse expect to find? Everything go down except your weight. Once again, everything going down except your weight. Therefore, what do you see? Weight loss, go up. Eat, go down. No intolerance. Bradycardia, down. Constipation, down. Your weight, what does that do? What does your weight do? Everything go down except your weight. It goes up. Therefore, BMI is high. You see the strategy? And then a client at 36 weeks, gestation has a blood pressure of 150 over 100, proteinuria, and report headache. What is the problem? Maternity, air promotion. I see blood pressure. I'm pregnant. I have proteinuria and headache. This is preeclampsia. Which is the priority nurse action? What do? give them metadopa for their blood pressure, give them sedative, prepare for emergency delivery, or give them magnesium sulfate. This is a test-taking strategy. We have to treat the problem. If it doesn't help, before we take them to surgery. If somebody is going to have seizure, you got to control them, stabilize the patient before you take them surgery. Surgery is never always the option. Preparing for emergency delivery, you have time to give them magnesium to calm them down. Sedative, treating the hypertension is not the problem. That's bad decision. This question may be hard. If you don't know, it's okay, but there's a concept here. What should the nurse do? A newborn has a heart rate of 90. That is bradycardia, bad problem. Bradycardia for this patient. Remember, newborn is 110 to 160. This is bradycardia. Do you start chest compression? Assess their heart rate in 5 minutes? Give them positive pressure ventilation or oxygen? Most time when kids are in trouble is hypoxia. And when they are severe bradycardia, the first thing you do, give them oxygen. No chest compression. But this is very important. And write this down. If your heart rate is less than 100 in newborn, they require immediate ventilation. That is positive ventilation. Right? That's neonatal resuscitation. You do chest compression. If after you're giving them positive ventilation for 30 seconds and nothing is happening, and then their heart rate is still low, then you can do something about it, especially if it's less than 60. But this is the concept. Paclitaxel is prescribed what? Carbidopa, levodopa. This medication shows up on the NCLEX every time, whether you like it or not. Every time you hear Paclitaxel, this should come to your mind. Carbidopa, levodopa. You have to know the side effect, things you need to monitor for, complication, overdose. The nurse should teach the client to monitor for which side effect: increased salivation, constipation, orthostatic hypertension, and bradycardia. What do you think? The major side effect associated with this is orthostatic. And because they're already falling, that's why we have to monitor them. It can change your secretion also in color, but they have to know. This is very, very important that they need to know orthostatic hypertension. There's a key concept associated with this. I want you to pause the video, write this concept down. How should the client use crutches? A client is prescribed non-weight bearing on the left leg. That is very, very important. This is not a normal crutches. This is non-weight bearing. That means if you have two legs, one of them cannot touch the ground. Non-weight bearing. You cannot even toe touch it. That means you cannot even touch your toe. It has to be above the ground. It's like you have amputation. So think about it like somebody have left leg amputation. How are they going to use the crutches? Move both crutches forward and swing the left leg forward. Move the crutches forward, then swing the left leg through, right? Move both crutches forward and swing both legs forward. Move the crutches forward, then swing the left leg through. Move the crutches forward, then swing the body forward with the right leg. Pay attention. Move the right leg forward, then move the crutches. There's a concept. Pick your answer and let me know, and I will give it to you. Write it down. Don't never forget it. You pick your answer. I can tell you, if you have this order, no weight bearing, that leg is considered as an amputation. You can't move it. You can't touch it on the ground. Therefore, you have to swing through. That's the only way you can move. And which leg is going to swing through is what? The good leg. Therefore, you move the crutches and you swing through with the good leg. That's how you move in this situation. Therefore, move the crutches forward, then swing through the body with the right leg, which is the unaffected leg. And that's how, and this is the NCLEX step. And this is preparing to reposition a client who has a pressure injury on the sacral and the sacrum. This is what best care and comfort, right? Which action is most important? Position the client at the 30-degree lateral tilt. Use a donut cushion under the sacrum. Place a heating pad over the pressure injury. Elevate the head of the bed to 45 degrees. There's a strategy here regarding this particular question. When you see it, how to prevent pressure injury is to prevent too much shear pressure on that portion of the bony prominence. Which strategy is most important? You pick your answer. Lateral tilt. This allows distribution of pressure across the whole, and it's very, very important when you place the individual 30 degrees laterally, prevent pressure. Donut causes too much pressure. Heating pad is going to cause injury. Head out of bed 45 degrees is still the whole body is touching and there's pressure there. It's not the best answer. And this is reinforcing home safety education for a client diagnosed with Parkinson's disease. What is their problem? 4. You have to bring all these little things together. The question is not going to give you the concept. I hear Parkinson and know these people falling. And because of their resting tremor, they cannot do certain things. Therefore, what would I do? Which statement by the client indicate the need for further teaching? If they're doing something that will make them fall, further teaching. That's all. I will remove throw rags from my house. What do you think? I should install a grab bar in my bathroom. What do you think? I can wear slippers when walking around my house. Do you think it's a good idea? I will use a night light in my bedroom and the hallway. Which of this is a violation, safety violation, and will cause this Parkinson patient to fall? Pause the video, pick your answer. Walking with slippers in the house is a bad problem. When you have light, you can see. When you have grab bar, you can hold on. When you have throw rugs or remove, you cannot trip on it. C is the right answer. Which action by the nurse require intervention? Selected apply. The nurse is caring for a client with hearing loss. This is always a problem. It's easy to miss. Hearing loss and vision loss. When you're taking care of this patient, remember, when they lose their hearing, sensitivity increases in certain areas of their senses. So you cannot do certain things. What should you not do? Require intervention. The nurse speak in high-pitched tone, right? The nurse directly faces the client when speaking. The nurse dims the light when speaking. The nurse ensures hearing aids are functioning, and the nurse uses facial expression and hand gesture as needed. Which of these require intervention? Remember, the patient cannot hear, but they can see you. Therefore, when you're doing things, make sure, tell yourself their eyes is now their ears. That's the strategy. That's the concept. If I cannot hear you, everything you're doing, I can see, and I can hear through my eyes. Therefore, the nurse speak in high-pitched tone is not. They can hear you. Speak normally, they can read your lips. That's a problem. You face them directly. When you speak, they know what you're talking about, even though they cannot hear. They are, like I said, their senses is now, hearing senses is their vision now. The nurse dim the light when speaking. They cannot see your your lips, and your eyes cannot see you, so they can't tell what is going on. The nurse ensure hearing aids are functioning, to promote hearing. The nurse uses facial expression and gestures. They read your gestures and they can interpret it. These require intervention. And this is assessing a client with abdominal discomfort, examination, fundamentals, assessment. The client described pain as diffuse everywhere. Pressure-like. It's not sharp. Difficult to localize. That means it's diffused. Difficult to localize is not sharp. Therefore, you know certain type of pain, right? Which one? Somatic, neuropathic, visceral, and refer. I'll show you strategy. Using definition. A refer pain move from one place to another. The description never say that. D is gone. You see the first thing is gone. Somatic pain, neuropathic pain, it will say shooting pain. B is gone. A visceral pain is non-specific, diffuse. I can't feel anything. That's the right answer. Somatic, sharp, you know exactly where it's coming from. That's your answer choice. Next generation. I know when you see this table, you want to think like this is a difficult question. It's the same thing, you know. Take the table out, unravel the parcel, look at it in a different way, rewrite it. If you have a pen and paper, rewrite the question and say, this is a selected apply. There's no table. And then she's preparing more care for a deceased client. Which action are appropriate? That's all. Take the table and read each one of them and say, if somebody died and I'm providing post-mortem care, this is what best care and comfort. What would I do? Open the client eyes and mouth gently for drainage. Place the client head in the supine position with hands at the side. Remove tubes and lines. Cleanse the body and remove soil linens. Removed dentures if available. Apply a clean gown and fresh linen. Allow the family time with the body before transport. What are the things you do? Which one is appropriate? This is inappropriate. Open the eyes and mouth wide for drainage. No. Dignity. Eyes should be closed. Place the head in the supine position with the hand. Inappropriate. The face will be full with blood. Inappropriate. Remove tubes and lines. You don't know. You have to ask permission. Is this patient going to have autopsy? All of this, you cannot just remove them. Cleanse the body and remove soil linen. Of course, dignity. Remove dentures if available. You disrupt their facial appearance. Inappropriate. Apply a clean gown and fresh linen. Dignity. And allow the family to be with the patient. This is what you see. And this is providing teaching to a parent of a 12-year-old diagnosed with scarlet fever. Scarlet fever. Which complication the nurse should include in the teaching? Selected apply. Pyelonephritis, meningitis, heart failure, arthritis, glomerulonephritis. This is med-surg question parcel together with what? Infectious disease, infectious control. Think about it carefully. There's a reason why I say scarlet fever and what kind of complication. There's one thing you need to answer the question. You have to figure it out. And when you figure it out, you'll be able to pick the answer choice easily. You pick your answer? I give you 2 more seconds. Do you pick your answer? It's a selected apply. Don't over-select. Pick those that you're 100% confident. But let me show you the strategy where to pick your answer. Scarlet fever. What causes it? This is strep. Strep causes a bunch of infection. Right? You can have what? Strep infection, and you can have rheumatoid problem, acute rheumatoid issue, right? Rheumatic fever, and that's the issue. Therefore, if I get rheumatic fever from strep B, what will happen? Heart problem. That's the first thing. You see? You can also have arthritis associated with it. You see the clue? And it can affect post what? Strep infection. It can affect your kidney, glomerulonephritis. So this is a hard question. It does not cause meningitis or pyelonephritis, but these are the conditions. If you have strep infection, you're likely to get them. These are all associated with strep infection. And let's provide care for a client with what's suspected active pulmonary tuberculosis for 4 weeks of night sweat, weight loss, cough. That means he has all the signs and symptoms of what? Active TB. We did a method skin test, positive. That means PPD test is positive. Which prescription the nurse should anticipate from the healthcare provider? We know this patient probably has what? Tuberculosis, which is active based on signs and symptoms, night sweat, weight loss, cough. And we have PPD that is positive. What next? Repeat the tuberculosis skin test, quantiferon gold test, 3 mornings, sterile sputum culture for 3 consecutive days, get a BCG. This is a trap. but it's concept. I know you know it. What is the concept here? What is the concept? We got to confirm the diagnosis. PPD is a screening test. It's not confirmatory. To confirm it, I need to do a culture. Which of these do a culture? Morning sputum. Get 3 morning sputum, send into the lab while the individual remain in airborne isolation. You don't need to repeat PPD. When you get 1 PPD test, you're done. Quantiferum is a gold test. It's the same thing. It's going to tell you the same thing. BCG is a vaccination. We need to confirm it. Confirmatory is culture. And this is teaching a client who is scheduled for coronary angiography. Which of the following instructions should the nurse include? You should not have this procedure done if you are allergic to shellfish. You will be given general anesthesia during the procedure. You will need to keep your affected leg straight following the procedure. You should have nothing to eat or drink 5 hours before the procedure. What is the teaching you provide, pre-op teaching for a patient who is going to have cardiac catheterization, cardiac angiography? Pause the video, pick your answer, but pay attention. Cardiac angiography, right? What do you think? I can tell you shellfish allergy is not a problem. We need iodine allergy. Nowadays, shellfish allergy is not a problem. Don't pick it. When you see it, it's a trap. I put it at number 1 to pick so that you can pick it. You don't need general anesthesia. Patients are awake. It's a local anesthesia. That affected leg need to be flat for at least 6 hours. This is good. And you should not drink anything for at least 8 hours. So 4 is the wrong answer. And this is assessing a client who has a permanent pacemaker placed 4 weeks ago. So yeah, pacemaker placed. Which client statement is most concerning and require follow-up? This prioritization, risk reduction, pace management, pacemaker placed, and they're telling you something. Pay attention to the words. Whichever you hear that you know is not consistent with the pacemaker placement is a problem. I notify airport security about my device. I have had hiccups for the past 2 weeks. I stay away from garage door openings. I wear a medical alert bracelet. Which of these require follow-up? All of them may require, but which one? The question say most concerning that require follow-up. The right answer is hiccups. It means displacement. That means it's irritating your diaphragm. And that's why the cardiac pacemaker, usually this is your heart. They start from your left side and you go all the way to the vein, big vein, and you go into your heart, superior vena cava, and go into your heart and they put it where they want to put it. And it stimulates your heart, right? Like a pacemaker. If the tip of the pacer is irritating your diaphragm, you're going to have cough. So it means more placement. It's no place where, and that's the problem. It's okay to report to the airport that you have a pacemaker. C is too much. You can still open a garage. There's nothing wrong with it, but it's not a big problem compared to 2B. Wearing alert bracelet is also a good thing. So that's it. And this is assessing a client for changes in level of consciousness using a Glasgow coma score. The client would open the eyes, move the extremities when pain is applied, but speak incoherently. What do you think? Which of the following GCS scores should the nurse document? You have to calculate it based on what the patient is doing. So if you need help, check adapting this, but it's a strategy. It's a mnemonic you can use to calculate GCS. You know, you got to find your E, you got to find your V, and then you find M, right? What is the problem? Is eyes and what? Motor function depend on pain. That means he's getting what? E, he opens his eyes when you pinch them. That's 2. And the motor, he opens it when you pinch them. He moves when you pinch. That's 4. And because it's verbal, he speak incoherently. That give him 3. So we have E2, V3, M4. That give you what? 9. Now, and this is providing teaching to a client with the following new prescription. Match the medication to the appropriate priority teaching, pharmacology in a different way. Levothyroxine, phenytoin, etabitol, digoxin. What do you know about it? Who need the frequent eye exams? Who need to call the doctor if they have nausea or diarrhea? Who need to remain upright for 30 minutes after the medication? Who need to avoid high protein diet? Prioritization, pharmacology. Pair them. Stop the video. Pick your answer. Let me know. Digoxin, if you have nausea and vomiting, toxicity. Levothyroxine, you got to remain upright for 30 minutes. Phenytoin, avoid protein. And etabitol, you're going to have optic neuritis, so you got to see ophthalmology frequently to get checked. The client is prescribed doxycycline for acne. Which statement at discharge indicate correct understanding? I will take this medication with milk to prevent stomach upset. I should use sunscreen when going outside. I can stop taking the medication when my skin clears up. I should take this medication at bedtime. There's a reason why I give you this doxycycline. It's very, very important. We use it for acne, but there's something you're supposed to know. They can ask you. It can also be used for UTI. But what is the key? What is the key? It's one of the tetracyclines. Things you have to know about it. What do you think? You pick an answer? You pick an answer. It causes photosensitivity. Therefore, use sunscreen when you're going outside. For this tetracycline, you should avoid milk. You should not stop taking the medication, and you can take it anytime. You don't have to take it in the evening. That's very important. And this is performing medication reconciliation for a client being admitted to the hospital. So checking the medication. Which medication by the nurse? Which medication have the most potential risk for injury? That means 4. That's all. When you see that medication potential risk for injury, safety, falling, that means things that will cause people to get sick and fall down. Means what? Dizziness, orthostatic. Which medication? Buspirone. Does it cause any dizziness, sedation, or anything like that? Lorazepam. Does it cause any sedation? Alprazolam. Does it cause any sedation? Diphenhydramine. Does it do that? Nortriptyline and clonidine. Which of these does that will cause the individual to fall? Therefore, sometimes you got to give it in the evening. Buspirone, no sedation, no nothing. Lorazepam, benzos, alprazolam, benzos. Anticholinergic associated with what? Diphenhydramine. TCA, anticholinergic. Clonidine is central acting. All of this can cause fall. RH negative mother delivered RH positive. That means the problem. That means the mommy has been synthesized. Therefore, how can you prevent it? When should Rogan be given? Within 72 hours of delivery, during the next pregnancy, at 24 weeks gestation, only if the mommy develop antibodies. Pay attention. Mommy already delivered and the baby is positive, and we know mommy is negative. And therefore, we know mommy has antibodies. We got to prevent further antibody production. So 28 weeks, if you pick it, 24 weeks, if you pick it, is wrong answer. Mommy already delivered. So are we going back? No, we can't put the baby back. During the next pregnancy, well, you want her to get more antibody in the system to become more sensitized? No, within 72 hours. And this is what? Teaching the parent of a client with what? ADHD about methylphenidate. What do you know about it? Which statement by the parent indicate correct understanding? ADHD and methylphenidate is a stimulant. It helps with what? These treatment of ADHD. But a side effect the NCLEX love to ask. And that's what we're going to talk about. I will give the medication right before bedtime. Should you give it in the evening? It's a stimulant. The medication may cause my child to gain weight. It's a stimulant. Do you think they're going to gain weight? I should monitor my child height and weight regularly. Do you think you should do that? This medication will cure my child ADHD. Do you think that's the function of the reason why we're giving you the medication? I can tell you, if you stop the video, pick your answer, I will show you how to approach this answer choice. It's a stimulant. Stimulant, what do? Don't give it in the evening. You're not going to eat. You're going to lose weight. Therefore, you can gain weight. Because of that, we got to check your weight and your height. And of course, we are not curing you from this. A 3-year-old child with leukemia is scheduled for routine vaccination. Which vaccination should the next question? This is a key word. The buzzword is leukemia. And leukemia should not get live vaccine. Then you look at the answer choice. Which one is a live vaccine? DTaP, H, influenza type B, MMR, and then what? Pneumococcal. Thinking about it, and you know, MMR is live vaccine. Stay away from it. 68. And then she's teaching you graduate about what? Colloids. What do you think? There's crystalloid and colloid. Crystalloids are what? Normal saline, lactate ringer. Colloids are like blood, albumin, and other things. Therefore, what do you know about them? Which of the following information? These are fluid and electrolyte question fundamentals. Include in the teaching. Before under what? Physiological adaptation. Select or apply. They are very small molecules. They can easily move between anatomical space. Is that so? Colloid. They stay in the intravascular space. They causes allergic reaction. They are associated with coagulation and bleeding complication. What do you think? They are not that small. They're big. That's why they stay in the intravascular system. They don't move between anatomical spaces. They stay in intravascular space. It causes allergic reaction and it can cause coagulation problem. That's the major problem. That's why we don't use them unless we have to. So know the difference. These are colloid features. And this is assessing a client with the small bowel obstruction receiving NG tube decompression. That means we pull in fluid because you have obstruction for 4 days. Which electrolyte abnormality the next you expect? Hypernatremia, hyperkalemia, bicarbonate greater than 24, and hyperchloremia. You have to know this. If I put NG tube in and I suck all your acid, what is going to happen? I suck all your sodium, what is going to happen? I suck all your chloride, what is going to happen? Your sodium is going to affect your potassium. What do you think is going to happen? There's a classic lab work. You see it all the time. And you may see it in Q-banks because it's very, very important. This is the same thing scaled with pyloric stenosis vomiting. If we suck all the acid, you become alkalosis. What kind of alkalosis? Metabolic. Your sodium go down, hyponatremia, no hyper. Your potassium go down, hypokalemia. Your chloride go down, you have hypochloremia. You have metabolic alkalosis. Your bicarbonate is going to be greater than 24. This is fluid electrolyte acid-base status. 70. And let's receive an order to infuse what? 1,000 ml of 0.9 normal saline over 6 hours. If only micro drip IV tubing is available, what is the approximate drop per minute of the infusion? This is dose calculation. And this is the order you receive. Infuse 1,000 ml of 0.9 normal saline over 6 hours. How are you going to do it? There's a strategy there. The key question is what? It's a micro. Don't forget, there's a micro and there's macro. When it's a micro drip, that means your drip factor is 20 drops per minute. For this question, all we care about is the micro drips. Therefore, we have 1,000 ml, right? We're going to give it over 6 hours. We change these 6 hours into 1 hour over 60 minutes. Then what is our drop factor? 20 drops per ml. And this is what you're going to calculate. Hours can say hours, ml can say ml, and you have drop per minute. In the process, you're going to get 56. So this is your right answer. This is what you're going to see when you do the calculation. But remember, what factor you're going to use is 20 drops per ml. Very, very important. And this is a dose calculation question. If you need more, check our doctor class. I have a bunch of them there. And this is caring for a client with what? Diabetes, who have what? Diaphoretic, confusion, and lethargy. You may see these questions all over NCLEX. They always ask this question in YouTube, but when they see you, when you're doing practice question, you see it. I want you to stop the video and listen carefully. We have a diabetes patient who is diaphoretic and is confused and lethargic. Which of the following actions should the nurse take? You may see videos that will talk about it, because it's a common questions that the NCLEX will ask you. Administer oral glucose, administer glucagon 1 milligram IM, check your capillary blood glucose level, administer the scheduled dose of glargine, because it's a common question that can show up because everybody who have diabetes will present like that. So you got to imagine that. What would you do? Pick your answer, let me know. And I'll show you next time when you see it. If you get it right, good. If you not, pay attention because they can change the question. Diabetes patient. I know this patient has diabetes. Patient is diaphoretic. That's symptoms. Confused, symptoms. Lethargy. These are signs and symptoms of hypoglycemia. I have everything I need to know that this patient is hypoglycemia. I don't need to check lab work anymore. So if you see question that you select that, that's wrong. You shouldn't check capillary blood glucose again because I already know that these are signs. There's classic. There's no two ways about it. Hypoglycemic. If you don't know, there you can check it. There's no confirmation anymore. That's the key. Diabetic patient, diaphoretic, confusion, lethargy. I have my diagnosis. Now, ask yourself, can I give this patient something to drink or can I give them IV? You want to know, is the patient conscious versus unconscious? In this situation, if you confuse, your airway cannot be protected. If you have lethargy, your airway cannot be protected. Therefore, we think you are unconscious in this situation, even though it doesn't say confusion, lethargy, I cannot protect my airway. Therefore, I have to give you something other than your mouth. Therefore, oral glucose may be okay, but because you're confusing lethargy, you're not going to get it. Glucagon will increase glucose. If you give them glargine, it's going to lower their glucose level. Therefore, every time you see this kind of question, please ask yourself, is there clear evidence of hypoglycemia? If there is, I'm not checking glucose. And if there's a clear evidence, is the patient conscious or unconscious? If they're conscious, yeah, you give them something by mouth, 15 grams of glucose. If they're unconscious, IV or IM. Pay attention to that. And this is a build up on that. And nurse is caring for several clients with diabetes who is experiencing hypoglycemia. I never told you they're confused or anything like that. Therefore, we're going to give them what? Glucose, 15 grams. Which of the following should the nurse administer? Now, you don't see glucose there, right? So this is what the NCLEX second level test taking strategy, passing level question. NCLEX wants you to think and say, hey, do you know what it means by 15 grams? If there is no sugar there, what would you give the patient? There's things that has 15 grams of glucose that you should know how to give it to the patient. And what do you think? Pick your answer. Let me know. It's a select or apply. You don't have to over-select. You pick your answer choice. This portion of the video, I want you to watch it multiple times. Write everything down. Come back to this section, 72, because there's a concept there. Half a cup of regular soda will give them 15 grams, which is the same thing as 4 ounces, right? A diet soda, there's no sugar. Therefore, don't pick diet. Pick regular soda. Half a cup or 4 ounces. 8 ounces of milk will also give you the same thing, 15 grams of glucose. You have to know for all these 4. Half a cup of orange juice, which is what? 4 ounces of orange juice will give you that. And a 3 or 4 glucose tabs will also do that. These are exactly 15 grams of glucose. And therefore, I want you to know them and then Pay attention to that. This, that. Half a cup of regular soda, 8 ounces of milk, half a cup of orange juice, 3 to 4 glucose tab is equivalent to 15 grams of glucose. And then perform medication reconciliation for a client with ECG finding. Which prescribed medication the nurse should recognize as the cause of this? You look at it and said, what is going on? This is what? What kind of EKG that? I don't know what it is. Is it caused by dopamine, bumetanide, bisoprolol, or benazepam? And I look at it and said, these look a little bit weird, right? What do I see? I see the rhythm, and I said, it's uniform. If I count from here to here to here, this is sinus. But I look at it, 1, 2, 3, 4, 5, 6. It's a long time. And look at it. Look at the PR interval. Very, very long. This is what? Too much. Bradycardia. Heart block issue. Prolonged PR. Therefore, it has to be a beta blocker. This has to be that one. This is providing teaching to a client who has been choosing copper IUD for contraception. Which statement by the client indicate understanding of the teaching? I will need replacement of the IUD every 1 to 2 days. Yes. I will be protected from sexually transmitted disease. I'm protected immediately after insertion. I will expect recurrent abdominal pain. If I give you IUD, copper IUD, which statement is true? You don't need to replace it every 1 to 2 years. It can take up to 10 years. You are not protected from sexually transmitted disease, but when you insert it, you're protected right away. So you cannot have babies right away. You can act right away. The copper is very effective. If you have recurrent abdominal pain, it means you're bleeding. And this is assessing a newborn shortly after birth. Since finding which finding require further evaluation? Umbilical cord with 1 artery and vein. Heart rate of what? 170 when crying. Respiratory rate of 40 and a large umbilical hernia. Which one do you think? Is a newborn question. Which one require further evaluation? A large umbilical hernia is a suspected finding. Respiratory rate of 40 is suspected. Heart rate of 170 when you're crying, usually 110 to 160. But when you cry, it goes up, it's fine. Umbilical cord, 1 artery, no, 2 and 1 vein. That's the key. 2 artery, 1 vein. And the last question. Thank you for sticking around. Thank you for watching this NCLEX practice question, NCLEX review question, NCLEX practice test. This is a mock exams. Last question, 76. Because of the case study, we have 2 bow ties and a 1 full, that's 12 questions. If you add it to 76, and then you have 85 questions. A client post-abdominal surgery suddenly developed what? Tachycardia, chest pain, oxygen saturation. What is the nurse first action? Apply oxygen, call rapid response, notify the surgeon immediately, obtain ABG, risk reduction. Patient had surgery, tachypneic, chest pain, SAT 84, dropping. This is pulmonary embolism until proven otherwise. If it's pulmonary embolism, what are you going to do? What are you going to do? We're going to put oxygen on them before we call rapid response or we call the surgeon. 85 question. NCLEX practice question. Thank you for watching. I know you get 65. If this video helped you, share with your friends. A little bit of comment in the comment section so that we can grow the channel. This is the only way YouTube will show this video to anybody. They like comment. So put some comment. Even if you put the love there or I5, we'll take it. Take care of yourself and good luck.